Hi, this is Dr. Mahadevan, and we're going to go over how to read a chest radiograph. This is going to be some discussion cases, so let's get started. First thing I want to tell you is I'm going to go over 5 cases, and they are very, very challenging. These are not going to be easy, so it's going to be very important to look carefully at the images to try to make the diagnosis, and I know you can do it. So let's start with case number 1 and a little bit of brief history. This is a 55-year-old woman with central chest pain, which is deep and boring, and she's also got diaphoresis. They do an ECG, and it's normal, and then they get a PA and lateral chest x-ray, which I'm going to show you now. Here is the PA chest x-ray, and here is the lateral chest x-ray. And the real key here is to focus on the diaphragm. So look at the diaphragm. Look at the diaphragms when you're trying to make this particular diagnosis. Case number 2 is a 62-year-old male with a history of hypertension. He complains of chest pressure 10 out of 10. He is treated with nitroglycerin spray ×3, and his chest pain only goes down to a 7 out of 10. They place a right internal jugular central venous catheter and get a chest x-ray, and here is what it looks like. The official read is a right IJ catheter with the tip at the caval atrial junction, a tortuous aorta, and low lung volumes. But look very carefully at this patient who subsequently develops shortness of breath and chest pain radiating to his back. What do you think is the diagnosis? Case number 3 is an elderly nursing home patient with a cough and worsening shortness of breath. She is intubated for respiratory failure, and they get a post-intubation chest x-ray. Let's take a look. Here is our post-intubation chest x-ray. So, what is the diagnosis in this particular patient? Case number 4 is a 15-year-old helmeted male traveling on his bike, a dirt motorbike, at an unknown speed. He crashes, his handlebars strike his right chest, and he comes in with chest pain and shortness of breath. His vital signs are a blood pressure of 137/82, a respiratory rate of 28, heart rate of 67, and a O2 saturation of 100% on room air. So let's look at his chest x-ray. Look very carefully. What is the diagnosis in this particular patient? And I'll give you a clue. The answer is not over the lung fields or the heart and mediastinum. It's on the periphery of this x-ray. And then finally, case number 5 is a 36-year-old helmeted male motorcyclist who ran into a car while making an illegal U-turn on a narrow 2-lane road, and he's thrown about 30 feet. Another motorcyclist in his group is pronounced dead on scene. This patient had a brief loss of consciousness and now comes in diaphoretic, tachycardic, and with altered mental status. He denies any chest pain or shortness of breath. So let's take a look at his chest x-ray. What's your diagnosis? These have been 5 challenging chest x-rays that we will discuss in our expert analysis.